Bronwyn, let's address some of the aged care stuff that is around today. A big issue in and of itself. But Brendan Murphy, the boss of the Health Department, he was out there yesterday basically saying, yes, there was some slow issues here and that could well have led to some deaths. In Victoria, of course, all as a result of the bushfire that the state government got out of control, but we can't pretend it didn't happen. Here's what the Aged Care Minister said today, responding to a report that was released at 4:45 this afternoon.
The government maintains its position that it has a plan in place. That plan has continued to be developed and evolved as we've learnt more about the virus, as we've learnt more about the way that the virus acts within residential aged care, and as our experience of managing the virus in residential aged care has continued.
Now, apparently some of the findings which have been put in by the Royal Commission thus far is that government funding to ensure visitors are allowed and allowed back now. More mental health services and National Aged Care COVID-19 plan is needed. Again, it's the 1st of October. We need to deploy infection prevention experts and the government has to report back in December. What do you say? Well,
the first thing is that these are people who are in residential aged care homes. That is their home. These people deserve to have dignity, to have respect from the people they work with. And shutting them off from their loved ones and people who would come and visit them is really a dreadful thing to do to them in terms of anguish, of mental health for them. The real problem was the use of agency nurses when you've got them going from home to home to home. Now, all aged care homes use agency nurses to top up when someone's away, whatever it is. But it wouldn't have been rocket science to work out a system whereby certain people could have been allocated to a single home where they would go so you're not getting those cross-infections. Now, the figures are these. 665 people have died in aged care homes. They've died in 225 homes. We have 2,800 homes. That means in most of them, it didn't occur.
There wasn't a national problem, there was a Victorian problem.
It was and 9 out of 10 died in Victoria. And so Victoria really does have to bear the brunt. And the point that was made earlier by Gary about criminal culpability under the laws that pertain in Queensland, they also pertain in Victoria, and that's why those people, in fact, are saying they don't know. They know very well. They're just lying through their teeth. But to go back to the aged care question, to have an infectious person, an extra person, to have extra people being paid for, you've still got to work out where are they coming from. Are they going to come from agencies? What are going to be the rules to see that you're not having that cross-infection? So I would have thought that the real thing that needs to be done and the real problems that need to be done is you need to look at the management where the failures have been, because a fish rots from the head. And if you see that the management is bad and the treatment of individuals by the carers is such that dignity is not given, that they care, and genuine caring about how they carry out the protocols in that aged care home. If those things aren't working, then that's where you have to go in. And Bupa was a classic example, and the South Australian government was a classic example, which kicked off the Royal Commission in the first place.